This is NBC Nightly News with John Chancellor and David Brinkley. Tonight, Monday, April 25th, reported from the NBC News Center in New York.
Good evening. The cost of health care in this country has been rising 2.5 times faster than everything else. A day in a hospital costs an average of $158, and in big cities, $200 and more, and rising fast. Today, President Carter said he would ask Congress to put price controls on hospitals to hold down these increases. Here are two reports.
The cost of health care has been rising about 15% a year, faster than almost every other consumer cost. The Carter administration proposes to curb that by putting a ceiling on what hospitals can charge for their services. The legislation announced today would prevent hospitals next year from charging more than 9% above what they charge this year, and no more than the increase in the cost of living after that. The government hopes this will force hospitals to economize. The administration says there are a number of ways hospitals can do that. Save on energy expenses. Cut down on unnecessary surgery and equipment. Economize on supplies. And, when possible, share services with other hospitals. And the administration wants to reduce the large number of beds that are not being used. HEW Secretary Joseph Califano says the ceiling is needed because hospitals operate like a monopoly, not concerned with costs.
There's no competition among hospitals. The person who is actually getting the service, in most cases, in the overwhelming majority of cases, about 90% of them, is not actually paying for that service, so he has no incentive to bargain. And there is no incentive on anyone running a hospital today to run it more efficiently, none whatsoever.
President Carter has said he will not impose controls on wages and prices, but a staff member of his Council of Economic Advisors says price controls are just what this program amounts to. Administration officials don't like to admit that because it stirs up fears that controls might be imposed in other areas. But administration officials evidently believe hospital costs are so high, it's worth running that risk. Judy Woodruff, NBC News, the White House.
Officials here at the Lewis Weiss Hospital in Chicago say they have already done almost everything they can to cut expenses, and yet they say their cost of operation has gone up almost 15% a year. In order for them to meet a 9% goal set by President Carter, they say they'll have to begin cutting back on services. The hospital will likely cut back its emergency room services. Administrators say the hospital loses money here. Patient meals will cost less. There will be fewer choices on the menu, and the quality of the food will be lower. The hospital's tumor clinic for cancer patients will have a smaller budget. Administrators say this, too, is a high-cost, low-return service. There is a free clinic here for people who cannot afford to pay. It costs the hospital $500,000 a year, and it will be cut out. Like many hospitals, this one teaches, too, and patients who stay here pay a share of the cost. To save money, these programs will be cut back. Executive Director Mortimer Zimmerman says it is unfair to put a ceiling on hospital bills without controlling hospital expenses.
Our cost increases are in excess of 9%, and unfortunately, those increases are beyond our ability to control. I'm sure you're aware of some of the problems we've had in recent years with the rapid escalation of fuel costs, for example. Professional liability insurance is another